This is a plain CT scan of temporal bones of a 43 years old male patient. He presented with loss of hearing on right side, tinnitus, pain, dizziness, and a feeling of imbalance. Now please observe, this is a mass here, this one, in the anterior part of posterior cranial fossa. It extends downwards, eroding lateral part of the petrous part of temporal bone and the medial part of the mastoid part of temporal bone. It extends downwards below the right side of base of skull surrounding. This is the styloid process here. Now I will show you his contrast NAN. This is the contrast NAN CT scan. Please observe this avidly enhancing mass lesion here lying in the anterior part of the posterior cranial fossa extending into the cerebellopontine angle. Now this is the internal auditory canal here. This one, there is no extension of mass into the internal auditory canal. Mass extends downwards to involve the jugular fossa. Now please observe, this is the jugular fossa on left side, while this is the region of jugular fossa on right side. This has been eroded. The mass shows intense homogeneous enhancement. Anteriorly, now this is the middle ear cavity here, right mastoid. The mastoid is cellular. Soft tissue attenuation medium is seen in all of the mastoid ear cells. The mass extends downwards. Now this is the carotid canal here. Mass extends downwards into right side of base of skull. Now this is the styloid process. The mass has surrounded styloid process, extends medially into the right parapharyngeal space. No internal jugular vein is not visible on right side. Internal carotid artery. Now on left side, this is the internal jugular vein. This is the internal carotid artery. On right side, the internal carotid artery has been partly surrounded by the mass. Now this is the internal carotid artery. Low down this one. The mass extends downwards. Its interface with the medial pterygoid muscle is intact, while with the lateral pterygoid muscle, this is the lateral pterygoid muscle here, its interface with the lateral pterygoid muscle is indistinct. This scan shows you the bone window details. Now please observe that right mastoid is cellular. All of its hair cells, these are occupied by soft tissue attenuation medium. This is suggestive of automastoiditis. Now this is the internal auditory canal here. This one is faintly visible mass here. Now these are the middle ear ossicles. Now please see that the mass has eroded posterior wall of the hypotympanum. Now this is the eroded lateral part of the petrous part of temporal bone, rather postero-inferior petrous pyramid, and this is the eroded medial part of the mastoid. Now this is the mass here, which is extending into the Eustachian tube here. Please observe that this is the site of Eustachian tube on the left side, while this is the site of Eustachian tube on right side. The mass extends into it. It has been occluded, and this has resulted in, this is the mass extending into the Eustachian tube. This has resulted in automastoiditis on right side. This is the coronal scan. Now this is the avidly enhancing mass here. It has surrounded styloid process. Internal jugular vein is not visible. Now this is the site of jugular fossa, and the jugular bulb is not visible. The mass, it has been eroded. The mass extends upwards into the anterior part of posterior cranial fossa and into the right cerebellopontine angle. This is sigmoid sinus, while this is the right transverse sinus, which are well opacified and normal. This scan shows you bone details in more clearly. Mastoid air cells occupied by soft tissue tenuation medium. Now this is the middle ear cavity, middle ear ossicles. This is the component of the mass which extends into anterior part of posterior cranial fossa, eroded bones here, lateral part of the petrous part of temporal bone, and this is the middle part of the mastoid bone. Now in this region the mass has eroded posterior wall of hypotympanum and extends into the middle cranial fossa. Now this is the component of mass which is extending into the proximal part of the eustachian tube here. This has resulted in otomastoiditis. This is the sagittal scan showing bone details, external auditory canal. This one here, I scroll it medially. Now this is the middle ear cavity, soft tissue component here. Please observe this eroded bone. The region of the jugular fossa and the jugular bulb.